You're watching Focus on South Florida.
Ahead, chronic headaches and migraines are a common problem for millions of people. When we come back, a closer look at a new FDA-approved device that could mean real pain relief. We'll be right back. Welcome back. Every year, millions of people suffer from chronic headaches and migraines, and for many, finding relief is temporary. This morning, we want to bring attention to a new FDA-approved device that's gaining a lot of attention. Many are saying it's actually effective at treating headaches, especially migraines. Joining me now is Dr. Fred Abeles. He's the director of the Atlanta Center For TMJ, as well as the regional director for the Las Vegas Institute for Advanced Dental Studies. Welcome, doctor.
Welcome.
Thanks for being here.
Great to be here with you.
So you say that the cause of most headaches is actually the teeth.
Well, we're close. The cause is the alignment. Our teeth aligns our lower jaw. If you think about it, the only joint in our body, Rutabaga, that is aligned by a bunch of teeth is the temporomandibular joint, or TMJ as it's called. So wherever our teeth fit together is where that jaw aligns. If someone's bite does not align the jaw where it should be, then all the muscles of the head and neck that have to try to hold that and support it and brace it can fatigue, they can stress, and they can drive a tremendous amount of pain. I can give you an analogy if you'd like.
Go ahead, I love analogies.
If I asked you for the rest of your show to hold your arm out to the side, don't do it. But if I said, hold your arm out here for the next 3 hours while you interview all your guests and complete the show, do you think you'll probably have some pain in your shoulder?
Yes.
Or some pain radiating up into your neck?
Yes.
And eventually down into your arm. So what happened? We asked a group of muscles to try to brace and support a joint in a position where it's really not supposed to be. We altered the physiology of that muscle and we get pain. So the good news is we can make a simple little bite device that aligns the lower jaw where the muscles are functional and happy, and the pain goes away. I could talk for hours about the physiology or the medical science of how it works, but we don't have time clearly to go into that here. When I do go into that at a dinner party, I can literally see the blood start to drain from their face when they say, oh me, why are we going into the details here? But let it suffice to say, the science is there, it's very effective, and it definitely works.
And you brought the device. Can you show? We don't have hours, but we have a couple minutes.
I know we don't.
You want to show us in a couple minutes
how it works? Yeah, so here is, sure, this is a little device. This is called Cephaly, and it's the first ever FDA-approved medical device for the treatment and prevention of migraines. It looks like something out of a Star Wars movie or Star Trek, so it's worn right here. What I don't have, there's a little electrode that you place right on the center of your forehead. It's worn for 20 minutes a day. It stimulates a particular nerve that's called the trigeminal nerve. The trigeminal nerve is one of the largest nerves in our entire head and neck, and nature's placed a lot of importance on it, and by that I mean about 40% of all the signals that our brain deciphers all day long just comes from that one nerve, from the trigeminal nerve.
Wow.
So if we can calm it and get it functioning better and not give these muscles to start giving off noxious stimuli to the trigeminal nerve, we can either reduce or we can completely eliminate the migraine and headache pain.
It's incredible. Why do you think so many people are misdiagnosed? You know, there are people who have migraines and chronic headaches for years and years, and they go to different specialists and doctors, and it's like they never seem to get the proper diagnosis.
That's a great question, and honestly, we see that a lot in our practice. By the time somebody typically arrives on our doorstep, they've been to the neurologist, they've been to the ENTs, they've been to the chiropractors and all these other people. And I'm absolutely not speaking adversely of them. I have the greatest respect for all of our medical profession. We're doing some wonderful, wonderful things. But headaches and migraines many times are just treated with pills. The quick fix approach is taken. So you go to a physician, there's a good chance you're going to walk out the door with a handful of prescriptions in your hand. And if they don't work, they're going to give you a few more to try. But if we don't identify the underlying tissue that's causing that pain and creating it, the pain's going to continue. It's just that simple.
Okay, well, thank you so much for introducing it to us, and thanks for being here this morning. We appreciate it.
Thanks for having me.
All right, and thank you for joining us this Sunday morning. You can connect with me on Facebook at facebook.com/RutabaeShabazi. Follow me on Twitter at RutabaeCBS4, or email me at rshabazi@cbs.com. I'll look for you during the week on CBS4 News at 5 and 11, and next Sunday as we put our world into focus. Have a great day.